Hello, everyone, and welcome to the Clinical Trials Project Management Series 2, provided by the Case Western Reserve Clinical Translational Science Collaborative. This series will be presented across 4 modules. In this module, we will explore assessing and managing risk and corrective and preventative action plans. Our objectives for today are to describe the processes of analyzing risk, developing a risk management plan, and developing an effective corrective and preventative action plan. First, let's discuss the process of assessing risks to your clinical trial. We started down the path of risk assessment in Module 1, focusing on the protocol. Now we're going to take that process a step further and consider risks to the project as a whole. An effective risk assessment takes a holistic approach to identifying potential pitfalls. We need to consider sources of errors, issues that may cause delays, access to all the necessary resources, and what costs might jeopardize our budget. Since the protocol is the central element of our project, it is a crucial component to this process. As with other aspects of our project, this effort is led by the PI and the project manager, with participation from the entire team. Engage your stakeholders at their preferred level of involvement in this process as well. This could range from wanting to attend the risk assessment meetings to being briefed on your risk assessment and management plans. Remember the project plan roadmap that we talked about in Series 1? Assessing risks to the project necessitates revisiting the project plan, scope, and milestones. Go through the roadmap and make note of all the potholes, yield signs, stop signs, and detours. For example, when and how do we need to report to the DSMB or medical monitor? What are our obligations to the funding agency? If this is a multi-site study, how are we managing startup, training, communication, etc.? With our risks identified, we need to consider what happens with the study should they occur and what risks really need managing. A risk matrix, like the example shown here, is a very useful tool. By considering the likelihood of a risk occurring and its significance on the study, we can quickly identify the greatest risks to our project and use that information to develop a risk management plan. When assessing risk, try to avoid the temptation to jump ahead to the solution. Project managers are problem solvers, and it is almost like a reflex to want to fix it. You and the team will be best able to develop that risk management plan if you first focus on identifying the risks themselves. It is also important to be realistic when considering where a risk falls on the matrix. If you knee-jerk into every risk being highly likely and critical, your risk management plan will be overly complex and difficult to execute. If you underestimate the impact of a risk, like the Black Knight from Monty Python and the Holy Grail, you won't be well positioned to control the damage. When brainstorming about risks with the team, keep it simple and make it visual. You could even add a tactile element by going with this sticky note method of filling out the risk matrix. With our risks identified, let's move on to managing those risks. Risk management is having a plan to eliminate the risk from occurring, reduce its likelihood or severity if it does happen, or proactive course correction if the risk does occur. As with all aspects of the project, we need to manage our resources wisely. It is unrealistic to develop a risk management plan that accounts for every identified risk. The plan will be as complicated to carry out as the protocol. It's up to the team to decide what risks require managing, but your plan will have the greatest impact if you focus energy and resources on the risks that scored highest on the matrix. The rest is a judgment call. You've likely heard the phrase low-hanging fruit. If the fix to the risk is easy to implement and will yield a benefit, go for it. Maybe a simple tool would manage the risk, like the apple picker in the middle. Perhaps that would be worthwhile. If managing a low likelihood, low impact risk would take major machinery, so to speak, it's probably not worth the investment. This familiar graphic used in Series 1 illustrates some examples of risk management strategies. We've reached a cliff in our project and need to decide how we're going to get down. We can avoid dealing directly with the cliff by going in another direction. We could break our fall with a trampoline. We could get someone else to take the jump for us, or we can accept it and hope for the best. When developing our risk management plan, we need to consider each risk and whether a proactive or reactive approach is the best fit. Can the risk be prevented or avoided? How would we do that? Is that plan reasonable and feasible? Then a proactive approach to managing the risk may be the best fit. There are some risks that we simply can't avoid. We will need to react to them if and when they occur. What we can do is plan for how we will address the issue if it does arise. Developing that action plan now will leave us better prepared to keep a small hole from developing into a crater. If it isn't written down, it won't happen. Be sure to document your management plan in the applicable study documents. This could be any combination of the Manual of Operations, Data Management, and Monitoring Plan. Going back to our novel pet drug case study, you recall a risk that the team identified was how to manage the timing of the rapid arterial line draws. We found an app for mobile devices that would allow us to document the timing of each drawn tube of blood. We tested it and found that as long as we synchronized the start of the timer with the start of drug administration, that it worked great. This process doesn't change anything in how the protocol is written. It's part of how we're operationalizing the study. So the details about the app and how to use it in conjunction with how the tubes would be handled was written into the Manual of Operations. With our plan written, we need to make sure that we have all of the resources and materials necessary to execute the plan. Everyone involved in carrying out the plan needs to be trained on the process. If any aspect of your risk management plan can be tried out in a test environment, that's ideal. This way, adjustments can be made if there's a kink in the chain. Remember that monitoring and control is cyclical, so we need to monitor the effectiveness of the risk management plan throughout the life cycle. So what happens when our best laid plans go awry or problems come up that we couldn't anticipate? Enter corrective and preventative action plans, or CAPAs. Think of a CAPA as its own miniature risk management plan. It has reactive and proactive components. Corrective action is reactive. How will we address the problem since it's happened? Preventative action is proactive. What will we do to make sure the error doesn't happen again? Just like an effective risk management plan, a CAPA requires getting to the root of the problem. This process is called root cause analysis. Errors are very rarely as simple as someone messing up. No one comes to work determined to do a bad job. A good strategy to use when conducting a root cause analysis is the 5 whys, essentially asking why 5 times to get down to the true cause of a problem. Let's work through the process of developing a CAPA by looking at a protocol deviation in which the blood sample was hemolyzed when it arrived at the lab, so it couldn't be analyzed. We'll talk with the team and ask our 5 whys. Why? The ambulatory lab that drew the sample didn't know what needed to be done with it, so it sat for too long. Why? The lab didn't have instructions. Why? The instructions hadn't been written down for the lab. Why? The team didn't think it was necessary because the study coordinator has always accompanied patients to the lab for the draw. The coordinator was double booked in clinic, so they couldn't accompany this patient. Why? The second study coordinator was on PTO and there wasn't anyone else to cover. So we have our root cause, which is environmental. The lab was lacking information and there were limited personnel resources for that day. Let's channel our inner fix-it Felix and develop our CAPA. The issue at hand is that we're missing a blood sample for this subject for this time point of the study. What's our corrective action plan? Are we still within window to ask the patient to return for a redraw? Is it too late? Regardless, we have a protocol deviation that needs to be reported appropriately. To prevent the issue from recurring, we need to address the environmental causes of the deviation. Lack of personnel the day of the visit was one of the whys, but for purposes of this example, let's say a third coordinator isn't feasible. But perhaps scheduling subjects in clinic needs to be looked at to avoid overbooking. We need to come up with a plan for how the lab is going to have the information that they need. Will that be training? How will we identify who needs trained, and is that feasible? What about equipment? Does the protocol or lab manual have instructions on refrigeration or freezing procedures that would apply here? Is that equipment available? What about our process? Is there an institutional system for managing these samples that we aren't utilizing correctly or is not working as intended? Would an info sheet that the patient gives to the lab help if a coordinator isn't able to accompany them? We have our plan. Now we need to put it in motion. What does success look like? And how and when will we check to see if the plan worked? Let's review the key takeaways from today's module. Analyzing risk involves a holistic review of what could go wrong across all aspects of the project. Determine the likelihood of the risk occurring and how much impact it will have on the study. Leverage tools like a risk matrix to help visualize the issues and prioritize their management. When managing risk, the team needs to make a judgment call on whether to accept low likelihood, low impact risks or implement a mitigation strategy. Be on the lookout for the low-hanging fruit, simple fixes that are easy to implement. Make sure that your risk management plan is documented and communicated with the team appropriately. Corrective and preventative action plans are here to help us manage risks that occur. They act as a mini risk management plan focused on addressing the specific issue at hand. The team needs to work together to conduct a thorough root cause analysis using the 5 whys method. The plan should address the root cause. Communication and teamwork throughout these processes is essential for the best result. Be sure to save the information sheet with important links and references to tools that have been mentioned throughout this series. Thank you so much for joining us for Module 2 of the Clinical Trials Project Management Series 2. Please join us for Module 3, Manual of Operations 101.